vitamin D3, cholecalciferol, vitamin D2, ergocalciferol, calcidiol, and calcitriol. They're all referring to the various forms of vitamin D in our body or in the food that we eat. Vitamin D3 is also known as cholecalciferol. This is the form made naturally by the body in response to sunlight. Vitamin D2 is also known as ergocalciferol, and this comes from plants. Vitamin D supplements come in the form of either vitamin D3 or vitamin D2. Calcitriol, or 1,25-dihydroxyvitamin D, if you prefer, is the active form of vitamin D in our body. Let's say you're enjoying yourself a fine day at the beach, or just walking out and about on a fine sunny day. That sun is beaming down on that glowing skin of yours. That sunlight contains ultraviolet B or UVB radiation, and when it hits your skin cells, it turns 7-dehydrocholesterol into vitamin D3, meaning cholecalciferol. Vitamin D3 in turn binds to vitamin D binding protein, and this is transported to the liver where it gets converted to calcidiol, aka 25-hydroxyvitamin D. Calcidiol is the storage form of vitamin D in the body. Calcidiol is later converted to the active form of vitamin D in the body, meaning calcitriol, or 1,25-dihydroxyvitamin D. This conversion of calcidiol into calcitriol, or calcitriol, mainly occurs in the kidney, but it also takes place in different tissues and cells of the immune system, such as lymph nodes, alveolar macrophages, and not only in alveolar macrophages, but in the alveoli themselves. So vitamin D can become activated in alveoli, the same cells responsible for getting oxygen into the blood and removing carbon dioxide from our blood? Yeah, those cells. The same cells that bacteria and viruses like coronavirus and influenza invade in our lungs? Yeah, those cells. So the vitamin D becomes activated by our alveolar cells and immune cells in our lungs. Perhaps that has something to do with our lungs' ability to fight off respiratory infections. Well, yeah, that's exactly the case. But this is a very big topic to cover, so I'm going to make this one my next video. Vitamin D in all of its forms is a fat-soluble vitamin. It's one of only 4 fat-soluble vitamins in our body, along with vitamins A, E, and K. Unlike non-fat-soluble vitamins, fat-soluble vitamins can be stored in the liver. This can be a good thing because it's nice to have that reserve when you need it. But it can also be a bad thing because that means that dangerous levels can accumulate in the body. And because of that, toxicity from fat-soluble vitamins is much more common than for water-soluble vitamins. However, this usually only happens when you take mega doses of supplements over a long time frame. Vitamin D3 is only found naturally in a few different food sources, mainly fatty fish like cod, swordfish, tuna, and salmon. And mackerel. Does anyone eat mackerel these days? I don't know. But what about milk? Milk doesn't naturally contain vitamin D3, but it has been fortified with it for almost 100 years. But other dairy products made from milk, like cheese and ice cream, aren't typically fortified with vitamin D and contain only small amounts. Some yogurts, juices, and breakfast cereals are fortified. For older adults to meet the recommended daily allowance of 800 IU, or international units, they would have to drink about 4 cups of fortified milk per day. Vitamin D3 mainly comes from sunlight though, not food. But the skin's production of vitamin D depends on a number of factors, only some of which you have control of. Humans first evolved near the equator in Africa. It's at the equator where the sun's rays directly hit the earth for most of the year. Our ancestors there, back in the day, wore little to no clothing, and that's why they never had to worry about being vitamin D deficient. Not that they knew what vitamin D was back then. But anyway, the more melanin in the skin, the darker the skin, and that protects the deeper layers of the skin from UV damage. Over time, as some groups of humans migrated away from the equator, their skin lightened to enable more efficient vitamin D production because of less direct sunshine. Also, in the last 300 years or so, people spent less time outdoors because of working in buildings. And in the last 100 years, people spent more time traveling in cars, which means less sunlight on their skin. And over the last 40 years or so, more and more people rubbing sunscreen lotion on their skin means less UVB absorption.
It rubs the lotion on its skin or else it gets the hose again.
And don't get me wrong, too much UVB light makes people more prone to getting skin cancer. It's a known risk factor for most of the 3 million plus skin cancers that occur every year just in the United States alone. So rubbing the sunscreen lotion on the skin, it's a good thing in general. So depending on the season, where you live, where you travel, the time of the day, the clothing you wear, the umbrella that you use, all of these factors determine how much UVB light hits your skin. The sun's rays are most direct between 10 a.m. and 3 p.m. However, the farther you live from the equator, the less UVB radiation you receive. People who live north of about 37-degree latitude can't make any vitamin D from sunlight from November to March, even if they spend all day outside bare naked.
Everybody's doing it.
Why is this the case? During the winter months, the Earth tilts away from the sun, ultimately leading to less sun rays hitting the Earth. And you know what else? Having darker skin means less UVB absorption, which means less vitamin D3 production. Also, as we age, our body becomes less efficient at converting UVB light into vitamin D3. And this is why older people, as well as darker skinned people, are more prone to having lower vitamin D levels. To make matters worse, many older people have reduced exposure to sunlight for different reasons and may not be getting enough vitamin D in their diet. Vitamin D3, which eventually is converted to the active form in the body, calcitriol, has a very important role in the body. Many roles, actually. One of the most important is to signal the intestines to absorb calcium into the bloodstream. Without enough vitamin D3, your body will start breaking down bone to increase calcium levels in the blood, and no one wants that. This happens even if you have enough calcium in your diet. Besides strengthening bones, vitamin D helps reduce fractures in the elderly by preventing muscle deterioration and reducing the chances of falling. But what is vitamin D deficiency? The official definition of a vitamin deficiency means that specific health problems arise as a direct result of not having enough of a specific nutrient. True vitamin D deficiency in children causes rickets, a bone disease where the legs become bowed. This is rare in the United States, though. Vitamin D deficiency in adults can lead to osteomalacia, meaning softening the bone, and osteoporosis, leading to bone fractures. So what if you don't have deficiency per se, but you have less than ideal levels of a specific vitamin? Well, this can increase your risk of various health issues, even though they're not solely responsible for these problems. This is what we call an insufficiency. Most medical societies consider someone vitamin D insufficient if their level is between 12 to 20 NGs per ml, or 30 to 50 nanomoles per liter. And vitamin D deficiency is a level less than 12 NGs per ml. Most experts consider normal levels being above 20 and less than 50 NGs per ml. And most people in the United States have values around 20. In the National Health and Nutrition Examination Survey, back in 2005 to 2006, 42% of adult participants had levels less than 20. The American Association of Clinical Endocrinologists says that values between 30 and 50 have potential health benefits beyond bone health. But there are a lot of conflicting studies on this, and randomized controlled trials are being done right now to try and sort this out. Based on my research, it seems like levels of around 30 NGs per ml is the sweet spot, but having too high of levels can cause other health issues. In one study, levels above 32 NGs per ml resulted in people getting less quality sleep, probably because higher vitamin D levels suppress melatonin production from the pineal gland in the brain. The risk of vitamin D toxicity typically occurs in levels above 100 in adults who are also ingesting substantial amounts of calcium. Vitamin D toxicity, whether it's from vitamin D3 or vitamin D2, generally occurs after inappropriate use of vitamin D. For example, when someone is taking mega doses of supplements. Vitamin D intoxication has been reported in adults taking more than 60,000 IUs per day. Symptoms of toxicity are related to increased calcium levels in the blood, which can cause confusion, nausea, vomiting, muscle weakness, kidney stones, headache, belly pain, and heart arrhythmias. It's especially important to avoid excess vitamin D in pregnancy because that can cause calcium levels to rise to the point of causing seizures in the mother and developmental problems in the baby. Some might wonder, can I get toxic levels of vitamin D just by lying in the sun too long? Well, if you don't ingest vitamin D in your diet or take a supplement, the answer is no, because prolonged exposure to sunlight by itself doesn't cause toxic amounts of vitamin D3 in the body. That's because there are multiple studies showing that prolonged exposure of the skin to sunlight results in a maximum level of 75. If possible, it's best to get vitamin D from food and from modest sun exposure, and be sure to avoid getting sunburn. So if you live north of the 37th parallel, which broadly divides the United States in half horizontally, you can only get enough sun exposure to make vitamin D during the summer months. But if you live south of that border, you can most likely get enough vitamin D from the sun alone pretty much year-round. So typically 10 minutes of sun a few days out of the week to the arms and to the legs without sunscreen will provide enough vitamin D3 production for adequate levels. The question of whether or not the general population should have their vitamin D levels measured is up for debate. On one hand, most healthy people who get some sun and or have enough vitamin D in their diet from fish or from fortified foods such as milk, well, most of these people will have normal vitamin D levels. But for people who aren't getting enough sun or not getting enough in their diet, they probably should have their levels checked. But it's not always practical for people to get to the doctor and get their levels checked, especially during the COVID-19 pandemic. So if you're not getting enough vitamin D from the sun and or from the foods that you're eating, taking a vitamin D supplement is a good alternative. For most people, 800 or 1,000 IUs either every day or every other day will be adequate. Me personally, I take 1,000 IUs every day or every other day, at least when it's not in the summer. I'll put a link to the one that I take in the description below. Some people ask, which supplement should I take, vitamin D3 or vitamin D2? They're probably about the same in terms of effectiveness, but vitamin D3 might be slightly better. Regardless of which one you take, if you do take one, it's generally advised to never take more than 4,000 IUs per day, as this can result in toxic levels over time. But there are other factors to consider, and this is why it's always best to have a discussion with your doctor. And just a few more things to remember. People with darker skin are more likely to have lower levels of vitamin D. Same for the elderly. Same for infants. Same for people who live in countries that don't have food that is fortified with vitamin D. Same for people who live in countries further away from the equator. Smokers tend to have lower vitamin D levels as well, and same goes for those who are obese. And all of these things that I just mentioned happen to be the same risk factors for people having worse outcomes with COVID-19. Is this just a coincidence? Is there a correlation? And is there causation? It's very interesting, and there are a bunch of studies about vitamin D that are related to COVID-19 that just came out in the last few weeks. And they're pretty mind-blowing. And this is going to be the topic of my next video, COVID-19 and vitamin D. Does vitamin D3 prevent COVID-19? Does it lessen the severity of COVID-19? Should people take vitamin D3 for COVID-19? If so, how much should they take? So hit that subscribe button and click on the bell notification. That way you don't miss out on that one. And I'll see you then.